Let's do a baseball stitch. When I'm finished, you will definitely see why it is called a baseball stitch. So you start this stitch by doing just a simple throw and make your initial knot on one side of the incision. And then you are just running your suture back and forth on either side of the incision so that the suture ends up on top of the incision. And again, you just want to make sure that you're trying as hard as you can to take the same bites every time to not only make the incision look better, but it's also a lot more appeasing to the eye when it looks symmetric. I feel like I have done this stitch the most when working with a neurosurgeon following a craniotomy procedure. I feel like it's done most places where there's not a whole lot of movement. So, obviously, on the top of your head, you're not going to be bending. So, running a suture like this should be okay compared to, let's say, a knee, whereas when you bend at the joint, the suture may break, and then that entire closure is then compromised. But if you've done interrupted stitches and only one of them breaks, you have more stitches to reinforce that closure, which makes it less likely for the incision to pop back open and the sutures to come out. When finishing this stitch, I usually go a little past the apex just to make sure to close that apex down as much as possible. And I'm sure you can see why it is called a baseball stitch.